sure na wala pong mabibreak sa PPE kasi once nag-break ang PPE, na nasa loob po ang nurse ng room, that is very high chances of the nurse getting contaminated. So ito po ang binigyan naming emphasis is the donning. At ang doffing naman po ay yung paglabas ng nurse sa loob po ng negative pressure room to a doffing area at linisin lahat ng ginamit niya, alisin lahat ng kanyang PPEs bago lumabas ng clean area para po hindi at ma-be sure and na hindi po contaminated siya, including yung kanyang scrub suit, paglabas po ng biocontainment area kung nasaan yung pasyente. So yun po yung donning and doffing and fit testing that I personally is very passionate of doing it even until now. Every time I see a nurse or a doctor not doing proper donning and proper doffing, I don't hesitate to say, hey, you have to protect yourself. There is nothing rush. Kasi po ang naging culture namin sa ER is, as an emergency nurse, I've been an emergency nurse for 18 years, and lagi po kaming rush, a culture of rushing to save lives, to go into a resuscitation na we don't even care, we don't even look at the parameter where the patient is. If we see a bloody patient outside ER, hindi na po namin tinitingnan kung sino yung mga sinong kasama niya. Basta ang objective po namin is to save the patient. Yun yung lagi ang culture ng ER. But it has turned into a very hard way, a change basically. Kasi po ngayon, I know it's still a priority to save lives, always. But then again, if you are not geared and you are not wearing your proper PPE, there is no rush to go to save the patient's life. Again, what you have to, we always, and we've trained our nurses at this pandemic time, there should never always rush. The thing is, you need to protect yourself in order to protect the patient. You should be donning correctly, and if you ever break anything while you're inside the room of the patient, even you're resuscitating, you need to step out because you are contaminated and you are at risk, and you are putting a lot of the people around you, including the nurses, the doctors, at risk, and we don't want that. So ang nangyari po, so we are very dedicated and very committed to doing the donning and doffing. And I'm very happy that I see my staff doing that every single day. And lagi po kaming may tinatawag na spotter. Kung hindi man ako ang nasa unit, is somebody that I assign to spot a doctor even before going inside ng pasyente, the patient's room. Kasi po before, kung ang alam lang natin is it's because it's transmitted through travel. But then again, at the beginning po ng second week of March, when we've seen nurses getting sick, doctors developing URI symptoms, whether it's just a body aches or simple cough, we didn't realize they're already contaminated. So nag-spread po ang COVID within the community. And that time, our hospital initiated this guideline of everybody who gets inside the hospital needs to be wearing a mask. And then after that po, you cannot come into the emergency department or in any entrance in our hospital without mask, whether what kind of discipline you are. And it is being implemented until now. Ngayon lang po ako nag-alis ng mask. As a matter of fact, I've been wearing mask for 12 hours. Parang iba na yung feeling ko ngayon. Parang I can talk very well. It's very liberating to talk without it. But again, as soon as I go to work, it's always on. Makikita nyo rin po na I'm wearing a headdress kasi parang naging isa po sa mga protection na this is not mandatory but the mask is naging mandatory, naging parang reinforcement na rin po ang pagsusuot ng bandana or anything that will protect the hair. Kasi ang na-notice po namin is if the nurses are just, ponytail, there's a tendency to touch your hair, and when you go inside without protecting your hair, when you go inside the patient's room, it can be contaminated. It can be because COVID is in the air or COVID is in droplet, so it can contaminate your hair. Then you unknowingly knowing it, you touch it, and then you touch your face, you touch your all entry points of COVID-19, which are your eyes, your nose, your mouth, even your ears. Hindi nyo alam na hindi nyo namalayan na contaminate nyo, nakapasok na ang virus sa loob ng katawan ninyo. So this has become, all nurses are wearing this, whether they are male or female nurses. And not just nurses, even the doctors are reinforced and encouraged to wear this. But the mask is mandatory. We also do a lot of social distancing in the emergency department. Even with our patients, we transfer our patients with 6 feet distance when we go to CAT scan, to X-ray, or to any kind of imaging. Even when we transfer them to the units or at the other ICU. And of course, we also, hand washing is big time. Hand washing is, like every time you in, out, whether you use a hand sanitizer, which has 70% alcohol, or whether you really wash when your hands are really soiled, you wash your hands with soap and water within 20 seconds. So ito po yung mga basic, and I know these are very basic, but we continuously do this kasi ito lang po ang best way, best solution which we can see, yung spread, para mapigilan ang transmission or spread within the community where we work, which is like in my case is the adult emergency department. During the first few days din po na nakita kami ng spike ng numbers ng mga COVID positive patients. I remember March 8th when my very first time to take care of a positive COVID transplant patient was that time. I volunteered to take care of the patient for hours and hours in the ED because I would like to feel, because that's where I learn. I learn when I place myself and hands-on a patient. This patient is a transplant patient, immunocompromised, and he didn't know where he actually acquired it. He said that he traveled to Virginia, and but by the nature of his comorbidity as a transplant patient, he can very well said like he got it like from somewhere, exposure in a grocery store, which actually he did. And after that, we tested him because he started having shorter breath. He's pretty much healthy until he started having shorter breath. He went to the ER. We tested him. After 2 hours, we told him he's positive COVID. I actually asked him, I said, how does it feel to have a virus inside your lungs? It's like, it's nowhere different having a pneumonia, which is actually the symptoms are very the same. But because his immunity is low, because he's a transplant patient, it makes him harder to breathe, and mas maging cautious rin po yung protektahan siya, because between me and him, I'm the nurse, I have to protect him because he's more lower in immunity compared to me. So that I will never ever forget that, because that was my very first COVID patient that I took care in adult emergency department. When we see the spike in numbers or increase in, numbers of patients being infected with COVID in our adult emergency department, what the hospital did is we implemented a policy of very strict no visitor policy. But in some points, meron din po kami tinatawag na, it's not always black and white. There's always a gray portion with reference to this strict visitor policy. If the patient is dying, if the patient is what do you call this, in a situation that he cannot decide on his own and he has a will or an advance directive that somebody up from his family can come in to decide for him when he stopped breathing or he started deteriorating, or if it's a pediatrics who is the mother or the father, it's hindi po parehong pwede, isa lang na siya yung mismong magte-take care of the patient, or anybody with who are mentally challenged or any physical disability that they cannot decide for themselves, there is somebody who is going to take care of them. So ito po yung mga excuses sa aming visitor restrictions. And until this time, we have not lifted the policy. Our hospital are very strict as to who goes inside a hospital, because again, we certainly believe that the contamination is not just trouble, it is in the community where we actually work. Another one is we also develop different units, which we call COVID units for our patients. We have a total of 105 COVID units ranging from telemetry, med-surg, to IMC and ICU, to a more, more sicker patients in ECMO, which is a machine that helps the lungs to rest, but breathe for them. And we call it like a biocontainment units. Ito po yung nag-admit ng mga pasyenteng talagang really like on the verge of dying, and they are very, very sick. As of this moment, I just look at our chart, and as I look at our infectious prevention unit as a whole, we have a total of 98 COVID patients in our hospital. We had 4 total COVID patients as of the moment in the ED, as I can see in my chart. I actually look at all the statistics so I can share you how often and how many COVID patients we are taking care in our hospital. Are there any questions? By the way, you are all quiet. It means like you are internalizing what I'm saying, or you're confused. Are there any questions from all the nurses around the world that is listening to me?
I think they will have. Yeah, I think they will have their questions later on, Ma'am Che. You can go. You can proceed.
All right. So another thing na ginawa po ng aming ospital is other than nagkaroon din, alam po namin kasi na magi-spike ang aming numbers in reference to yung padami po as we develop a more rapid or point of care testing ng POC sa ospital. Parami ang na-report not only sa Communicable Disease Center or Department of Health, even po sa ospital namin. So we anticipated like by mid-April na magpipik po ang aming pasyente sa aming ospital, meaning there will be magkakaroon kami ng surge, meaning we will not be able to safely, or we don't have the capacity to house them in our emergency department, or those 105 units that we develop as COVID units, and also for people or under investigation or patients with under investigation. So what we did po is we created or developed our phase 2 of the whole COVID emergency preparedness, na tinatawag po namin yung pagkakaroon ng mga tents or annex, yung pong developing ng mga tents sa katabi po ng mga urgent care namin ng hospital, at saka sa mismong katabi po ng emergency department namin. So ito po yung ginawa po namin sa mga tent, just in case yung mga testing hindi na po namin ginagawa sa ER, because kasi mas dumadami yung mga pumapasok. So pag hindi na namin sila kaya i-accommodate, yung pong mga tents na ginawa namin, may mga recliners lang po, mga chairs lang po yun. Sila yung ginagawa po namin, yung mga fast, they will register and we will test them, we will swab them, we call it nasopharyngeal swabbing, which is the best way to obtain the COVID test. And then after that, after 2 hours, we can tell them if they are positive or negative. Pag po nag-positive sila at may mga symptoms na ipiniresent, mainly is short of breath and fever, ipapasok po siya sa emergency department. And the rest po na nag-positive, which are all asymptomatic, ang ginagawa po namin sila is just give them the best patient education na self-quarantine nyo ang mga sarili nyo within 14 days and just go home. Basically, that's how you really actually treat COVID positive with who are asymptomatic. Pag po sila ay nag-present ng symptoms, dadalhin po siya sa emergency department and we will address it to whatever the patient needs. So ito pong mga tents na ito ngayon, nakatayo pa rin sa annex namin, even though we already picked like around on April 15. So ibig sabihin po, dumadami po hindi lang po volume ang dumadami sa aming ospital, kundi pa rin po yung acuity, lumalala. Meaning yung mga pasyente po is sicker and sicker, lalo na po nung nagkaroon ng outbreak sa mga nursing homes dito sa United States. So I'm not gonna lie, there were plenty, and there are still a lot of nursing homes po na basta nga po ang pasyente namin na galing sa nursing home, we just confirmed that whether we have not tested the patient or not, is confirmed positive na po ang treatment namin. Our management does not change whether positive or negative, because we just don't treat the numbers, we treat the patient. So pag alam po namin nagka-outbreak ang nursing home, at mostly po ang mga pasyente namin in nursing home, we treat them as they are really positive. Hindi lang po yan, nagkaroon din po ng nag-outbreak po rin sa jail or sa mga penitentiary units dito sa Baltimore. At meron din pong mga group homes, tsaka mga assisted livings. Kumbaga, kasi po bakit? Because most of the assisted livings at saka po yung mga nursing homes, they have one of the most vulnerable patients po na pwedeng mag-transmit i-contaminate ng virus, which is the 60 years old and above. So sino po ba ang mga elderly? Sila po yung mga nasa nursing homes namin around Baltimore. So marami po nung nagkaroon po na kami ng outbreak, ang ginawa naman po ng hospital to accommodate a lot of this, kasi nga po dumarami sila, nagkaroon po kami ng tinatawag na convergence with Johns Hopkins Hospital, which is also an academic training hospital. Medyo kakompetensya namin sila in terms of, sa mga nurses, research, and everything. If you will Google it, it's one of the greatest hospitals, world-class hospitals in the world. But because of time, because of the pandemic, we converged with them and built this called field hospital based on, naka-house po siya sa aming palaganap ng sakit. Iha-house po sila doon sa field hospital. Ang tawag po namin is doon ay Baltimore Convention Center Field Hospital. Doon po sila iha-house hanggang mag-second and third test na po sila at negative at i-discharge na po sila doon. So, this project po ng maganda dito sa Field Hospital, other than convergence po ng hospital namin at ng Johns Hopkins, this is supported and funded by the governor of Baltimore, who is Governor Larry Hogan, who's been very supportive, very vigilant. Siya rin po yung very strict sa mga policies. Nag-lockdown kaagad ang Baltimore at all parts of the Maryland, basically lockdown po ang Maryland way back, I think, second week of March until now. We have not lifted the policy. So when I say lockdown, and this is being implemented strictly all over Maryland, kaya po hindi sustained lang or stable lang ang pag-increase ng confirmed cases ng COVID-19 patients sa Maryland po, sa state namin. And that's basically what we've been doing ever since March. And a lot of the things that we've started that I said earlier we are just sustaining it and just continue doing it in order for us, with a hope na bababa ang rate ng confirmed cases at rate ng death rates ng Maryland, ng COVID patients po dito sa aming sa state of Maryland. We'll go back to emergency nursing. Ang mga practices po namin, I know this is not new to anybody, and I know you have the same practices. We see to it that number one, safety is for the nurses and all the doctors and anybody who is part of the healthcare delivery team na nagpo-provide po ng para mapagaling ang mga pasyente. And we continue doing this because we think that, if we were not going to treat our nurses the best way, nobody will take care of these COVID patients. Again, ang call ko nga po, ang aking advocacy, because as a COVID coordinator, COVID warrior this is not individual task. This is not just the nurses. And when they say nurses are heroes, no. I beg to disagree. Everybody is a hero. Anybody who is entitled, everybody who is engaged para po ma-eradicate inyong fight, ma-decrease ma-eradicate ang COVID-19 in the world is a hero. Because again, and I'm going to say this again and again, in this fight, we are together, and I do believe we will get through this together. That's my speech. Any questions? Sir Arlene, do you have any questions?
Yes, yeah. Okay, ako na lang muna mauna before yung iba. So,
sure.
Regarding the, nabanggit mo kasi yung spatter. So, the spatter...
Sa pagmangiibon. Naka-headset, pag ganyan, tingnan nyo rin.
So, Arlene, you said you were asking about...
about the spatter. So, the spatter that you've mentioned is an infection control nurse.
It does not need to be an infection prevention nurse.
Okay.
it needs to be at the beginning of our what do you call this, at the beginning of the dawn of COVID-19 in the ED. What we develop is we just have nurses, ER nurses as spotters, okay, because it does not need to be infection prevention. Any nurse who is very dedicated to prevent the infection is a spotter.
Okay.
So meaning I am spotting you, because this is team nursing. I am spotting you to be sure that you are correctly donning all your protective or personal protective equipments. Because again, ER nurses are always rushing. So when you rush, that's when mistakes, that's when you neglect things that are very important. It's,
Yes,
for example,
because you really need to monitor. You really need to. There should be somebody who will be monitoring the donning and the doffing.
Correct. So because Arlene, ang maganda pa dito sa amin, we taught and we in-service not just nurses, because as we go along with a lot of patients that madami kaming pasyente na COVID positive at saka PUI, most of the, like we can fill our 40 beds and we are in capacity. We taught and in-service not only nurses but also patient care technicians, and also we have transporters who transport the patient to don and doff and be our spotters. Because when you say you spot, the person spotting the nurse who is going inside the VCU or the biocontainment unit or inside the patient's room. The increasing number of COVID patients that we see in our ER, kaya na lang ng mga nurses.
So for those who still have questions, you can raise your questions now. You can just unmute your mic by yourselves, and then you can raise your question to Ma'am Che.
I'm ready for the questions.
Yeah. May mga question ba kayo?
Ma'am Che, I have questions po.
Hi,
Okay.
identify yourself.
My name is Rafi po.
Hi, magandang gabi. Magandang
Yes
gabi
po.
dyan. Magandang umaga here.
Okay. I have question po. I have confusion po. Just to enlighten me.
Sure.
Once the patient is COVID positive,
Yes.
right? And then he was recovered from COVID-19. So does it mean that the patient has already the immunity or antibodies? So
Yes.
hindi na po magre-reoccur yung COVID-19 sa isang pasyente once they already have that immunity.
I cannot guarantee. The first question is yes. They develop the immunity. It's just like any other disease. Once you have it, like chickenpox, or what do you call this? Ano pa ba yun? Tick dust? Is that chickenpox? Varicella? Once you have the disease, you develop the antibodies. And remember, pag bata pa tayo before, pag nagkaroon na tayo, sinasabi sa atin na you will not have it again when you grow up. And this is just like that. This is a virus. So, but your second question is, second question is there a guarantee na hindi na siya mag-recur? It all depends. It all depends. If you will be maintaining as healthy as you can be, you will not have any comorbidities, like, if you will not be immunocompromised, meaning wala kang mga, hindi ka mag-take na mga like if you will what do you call this? Medications like prednisone or any kind of anti-inflammatory drugs that you will make you suppress your immunity, pwede itong mag-reoccur kung ang iyong immunity will go down. So there's really, I have not seen and have not read any evidence-based, because again, this condition is very new. So a lot ng mga nababasa natin is all more research. Wala pa tayong very specific, and there's no clarity kung talagang once you have it not already, you will not have it in the future. So I can say, once you have it, you have the antibody, yes, but no guarantee that it will not reoccur. Did I answer your question?
Yes po, thank you.
You're welcome.
Yeah. So so tama yung sinabi ni Ma'am Che, a lot more things to be learned
Yep.
about COVID. Talagang nangyayari pa ngayon and it's ongoing yung research. Even the vaccine, even the bakit bata ang hindi masyadong naapektuhan at puro matatanda. Pero now, lumalabas na nagkakaroon na rin ng mga batang affected. So it's still on research right now. So that's why it's an ongoing research. Yeah, any more question? Any more question from our participants? You can just unmute your mic and raise your question.
Hi, ma'am. My name is
Hey,
Rod.
hi. How are you? Identify yourself.
I'm Rod. I'm in Saudi Arabia.
Oh,
I have a question.
Oh my God. I'm so excited. Saudi Arabia.
Barangay niyo rin po ako, ma'am.
Kumusta kayo?
Ma'am, I have a question. Kasi if a person is diagnosed to be with COVID positive, asymptomatic, now he now siya for quarantine for 14 days. Is there a possibility without taking any medication or taking anything, as long as na-quarantine lang siya, kept in one place, is there a possibility that this COVID will be pursuing with what we have experienced by this kind of patients? Or meron ba siyang tendency na magiging grabe yung kanyang COVID, that it will result sometimes to death? Or, I mean, worst scenario will be like that?
Yes. So your question is, you're asking if there are any other medications that can actually...
sorry ma'am. Meron diagnosed to be asymptomatic but positive of the COVID. Hindi wala siyang medication na iti-take or anything else. Ang gagawin lang sa kanya is quarantine siya 14 days. Yes. And then is there any possibility na this will become, once they tested it again, is there a possibility na mag-negative tong taong to, or is there a possibility that positive na talaga siya for the COVID?
Yes. Just to let you know, when we send positive COVID patients, we rarely, in the ED, we rarely send patients who are positive who are symptomatic, because more chances is this patient, when we send them home to quarantine themselves, they will deteriorate and their symptoms are going to get worse. So what we do with them, we admit them. So, but patients who are actually asymptomatic, just like, for example, but you know, they are the patients who doesn't have any other comorbidities, meaning wala silang mga diabetes, hypertension, or they are not immunocompromised, or they are not older, they are not even younger. We send them home, because the best way to really treat COVID-19 is to have rest, food, increase your vitamin C, and just time. It just treats time. So time just really treats COVID-19. So what we do is when we do the patient education to our patients who are going home, who are positive, quarantine yourself for 14 days, take, any kind of medication, anti-inflammatory or any kind of pyretic drugs, Tylenol, Motrin, because most the symptoms are, you're going to have to treat it as like, walang parang generic symptoms, ititreat mo siya ng pain and fever. Body aches, Motrin, or any kind of equivalent medication na ginagamit nyo for pain and anti-inflammatory or inflammatory medication, anti-inflammatory medications. I'm sorry. So what we do, we advise them to follow up with their primary care doctor after 14 days and to have them retested, especially if they are the working population, because in some point in time they have to go back to work. So once you have once after 14 days, they have to go to their primary care doctor or to the emergency department. They have to be retested, and once they are negative, they are negative. Some other doctors would like to have a third one just to be sure, because there was one in time dito sa United States na maraming false positive results. So parang nagkaroon kami ng, is this really true? Is this really consistent? Na talagang pag negative. So a lot of them are like having the second and the third tests, which are all negative. So now once you are all negative, and of course, not only the numbers, I'm saying, the symptoms are resolved, meaning there's no fever for 24 hours. You are not taking any medication, and there's no high temperature. You don't have body aches. you are not coughing as like really yung talaga pong ubo, and you are not short of breath, then your symptoms are resolved. But if any of this are still there, you are not completely, even though you're already negative, but you are not, your symptoms are not completely resolved, I say you still have, we advise them to rest for 7 more days and then get a clearance from the doctor to go back to work. And then when they go back to work in our hospital, we send them to employee health to clear them to go back to work. And again, and then of course with the advice of just continue to be, be healthy the best that they can. Did I answer your question?
Yes, ma'am.
But
Follow-up, ma'am. A symptomatic patient, once diagnosed to be positive, nakakahawa na ba siya? O hindi naman?
Yes. So alam mo, ano ang name mo? I'm sorry, what's your
Rod
name?
po.
Rod, alam mo, marami kaming mga na-experience na mga nurses, right? Doctors, na we didn't know had positive until they developed a very slight symptom. Like we thought it's just a regular body ache, and I can certainly tell I have quite a few friends, quite few nurses in the ED that nagkaroon ng body aches, and we send them home. And then we, maganda dito sa hospital namin, we developed this employee health testing center just for the employees. Now, once you develop those symptoms, you go straight to a nurse practitioner and have you tested that day. And whatever the results, 2 hours later, you have the result. The only symptom they have is body aches, which is kind of like common after 12-hour shift. And, they just continue working, but they didn't realize. And that's what we call the asymptomatic minimum, because they do have it, but they minimize their symptoms. But again, they are the ones that can spread the virus in the community, meaning in the adult ED. So we have one doctor that got positive. Fortunately, she doesn't have any comorbidities. She's not a transplant patient. She's young. She goes to the gym. She's healthy. But she got infected because why? Because she was not using the proper PE at the beginning of when she was seeing patients. She thought just a regular surgical mask is enough. Didn't realize that the patient has it, and then she infected herself. So we sent her home. She rested for 14 days, as a matter of fact, plus 7 more days, and was told to just be on light duty when she gets back to work. So ito ang marami na as a matter of fact, mas nakakatakot nga yung asymptomatic na hindi talaga nagmamanifest ng mga symptoms, kasi parang sila yung mas maraming nahahawa kasi, wala naman akong symptoms, I'm okay. But you have the virus itself and you keep on spreading it without knowing it. Yun ang mas nakakatakot, at yan, marami yan sa community ng mga nurses, sa community ng mga doctors. And I've seen that, and it's really just hard. That's why the implementation of everybody wearing masks and everybody social distancing in our ED is strictly implemented.
Yeah.
Did I answer your question, Rod?
Yes, ma'am. Thank you.
I did. You're welcome.
Yeah.
Yes, Ma'am Aina, do you have any question for Ma'am Che? Ma'am Aina.
Hi, Ma'am Aina. How are you?
Okay, while we are waiting for Ma'am Aina, I do have another question for you.
Speaker mo. Yan.
Okay.
Gaya ganyan.
Che, about the practices of nurses, or even kahit hindi nurses, healthcare workers, before you have your duty, your routine, and then after your duty, meron kasi tayong nababasa na taking shower before going home, and then we really need to inform our nurses what are you doing before and after your duty, before going inside your house. So can you just share your practices?
So my practices, so what I normally do is, because I'm very particular with my practices, because I have a 12-year-old daughter and I have a husband, so I don't want them to be infected. So what normally I do is, before going to work, I have my headgears. I have a complete good sleep, a complete good meal, and I hydrate myself. I have my mask and I have my PPEs always with me. I put it in the locker. And then I do bring also extra clothes with me. So when I go home, I am not wearing the same scrub suit that I got exposed to anywhere in the hospital taking care of patients. So I separate them. I have actually a separate hamper where I put all my scrub suits and I wash them with warm water. I wash them separately basically compared to hindi ko siya ini-include sa normal ko na mga damit. My shoes stays in my locker, even though I sanitize them with Oxivir. That's the brand that we use here, or a bleach. Anything stays, even my socks. I started bringing socks, shoes, something that I can just dispense if I don't need to bring it at home, especially if I know if they are contaminated or touched, like really used in the ED. So what I do is I never miss to take a shower before going to sleep. I work night shift mostly, so when I go home, it's like I have to take everything out. Even like in the mudroom, I already take it out. So anything that I am wearing is new. Every clothes that I'm wearing are like new. And then I go to the shower, and of course you do your routine, be hygienic, you hydrate yourself, you eat food rich in vitamin C to boost your immunity and all that kind of thing. And I can tell you, if you are a night shift nurse, you got to have a good sleep, because that only way you rejuvenate yourself to go back to work again. Again, I'm very particular. I don't share any food with my coworkers. We are very particular with each other anyway. We don't normally, because you never know. We are friends. It doesn't define that we're not friends anymore by not sharing, but we're just protecting each other from who knows, right? I hand sanitize. I wash my hands very well in the ER. Every time I touch a patient, every time in and out of the room, I be sure that all my proper PPEs. Fortunately, in our ED, maganda kung kayang i-provide ng inyong department. We have a sanitizing machine. It's called like a UV light, where we can sanitize other than wiping it with, antibacterial solutions. Like in our case, we have Oxivir and the bleach, Lysol. We put that after that, we put that in the machine. We light it up with 15 minutes.
I gotta get the link to
that. And then after that is 15 minutes is the great one. After 15 minutes, after 15 minutes, we take it out and it's actually sanitized and it smells good and fresh.
Cheryl, sorry.
Yep.
You were saying kanina na aside from yung coughing, fever, and difficulty of breathing, diarrhea is also part that you're checking now, or something.
Correct. Yes. You are right.
Thank you.
Yes, we do that. So on the verge, like this is maybe like 3rd week of March. Yes, we were constantly seeing not only the URI symptoms. Sorry, I have to move. Thank you, Stacy. So we are seeing a lot of GI problems coming into effect, or GI problems that are not only URI or upper respiratory infection symptoms, but we are seeing a lot of GI symptoms that are occurring, not only diarrhea, but severe abdominal pain. This is because I guess it's the contamination of the whole body system that would have caused them to have diarrhea. So other than the 4 questions that I originally asked, I originally said when they come into the emergency department and they see the quick look nurse, we call it, or the first surveyor nurse, we added that question: are you having any GI symptoms like diarrhea, abdominal pain, or even vomiting? We've seen this. So once we have those symptoms, that put the patient in high risk.
Yeah. Okay,
Did I answer your question? Are you also seeing this kind of patients in your department? whoever asked me the last question.
Rod is, hello Rod, are you still there?
Yes,
Yeah.
po.
Yeah. Any follow-up question?
Miss Cheryl, may question po ako.
Sure. Identify yourself first. What's your name?
My name is Rafi po.
Hi. How are you? Where are you from?
From Abu Dhabi po.
Oh, wow. Abu Dhabi. I haven't been there. Kumusta kayo dyan? Mag-iingat kayo lagi.
Thank you po. Question ko lang po, in your opinion po, ano po yung mas gugustuhin nyo? Number one, COVID positive patient but recovered? Or second po, or not having COVID-19 but you are mentally paranoid of what you might inquire or get of this disease.
To be very honest,
since po diba kapag nag-COVID-19 and you recovered, sabi po, you have antibodies already. So meaning to say, at least you have that immunity. Unlike po sa resistant ka po dun sa COVID-19, tapos po mentally paranoid ka po para baka po magka-acquired ka. So ano po yung i-weigh nyo po dun sa dalawa? Thank you po.
Thank you for the question. To be very honest with you, I don't prefer anything. I don't want to have any. But given the lesser evil, just to be very honest with you, once you have the COVID-19, I'm like basically from what a lot of my patients are, it has given them a sense of being, I say, dismissed, or parang kinatatakutan, parang iniiwasan ng maraming tao, because to them, even though they're already negative, because there's always like a fear of baka ako mahawa nitong taong ito. Look at this. Take it this way. When tuberculosis, way back a long time ago, was very contagious, but they found a cure for TB, they found medications that had really treated the patient well, unless the patient become immunocompromised at bumalik na naman yung, naging active na naman yung sakit na yon. Most likely, katatakutan na siya ng mga tao. Ang sa akin is, kaya kayo kasi napaparanoid pag kahit wala kayong COVID-19, is the fear of the unknown. The fear of you do not know what to do in order for you to be not infected. Paranoid kasi marami tayong knowledge deficit about COVID-19. If you will just be very particular with hygiene, hydrating yourself, consistently make yourself healthy, at alam mo na mag-follow ka ng mga rules and washing, social distance, wear your mask, you should not be paranoid. You should not be paranoid of infecting yourself. Kasi ito yung mga best ways para ma-prevent natin ang COVID-19. And if you will just consistently do it, and it will become part and culture of yourself, you should not have these negative thoughts that you will be infected anytime, anywhere you go. And again, it's up in the air. It's in the air. So if you're not protecting yourself, madali ka talagang mahahawa. So again, if I will be given the choice to choose, I will not choose any. But what I'm going to choose and what I'm going to do is I'm going to advocate for myself that I need to be living a healthy life. I need to be doing good hygiene about myself. I will sleep, I will eat, I will hydrate myself. And if I go to work, I will do the same way. I will eat vegetables. I will eat very basic, but this is the solution in order for you to increase your immunity, in order for you to not easily acquire the virus. Because the virus can be easily acquired if you are really with low immunity.
Yeah.
So that is just purely my opinion. But you can defer any, but to me, nothing beats the virus by being healthy and hygienic as you are.
Okay, Rafi. Any follow-up question, Rafi?
None so far, thank you.
Okay.
You.
Just like what you've said, Ma'am Che, it's basically basic prevention.
course.
It will just be, it boils down to the basic prevention also of flu. Get back to
Exactly.
flu. It will
Yep.
just be the same. Natuwa nga ako nung may narinig ako na isang nurse din from US, nag-share naman siya nung kanyang how she prepared herself after her duty. She even have her mouthwash and the Q-tips, and it's part of her routine: mouthwash, gargling, and then and the Q-tips. So it's all up to us because it's part of hygiene. So if you
exactly.
really make use it and practice it religiously, then you will be confident. You will not be paranoid at all.
Yes, exactly.
Yeah.
I agree. Because anything that you don't see, the thing is, anything that you don't know, anything that is unknown makes you paranoid. If you have the knowledge gap and you recognize that it's a deficit, why don't you learn? Why don't you educate yourself? Why don't you read things? In order for us to learn, there's nothing wrong in not trying to be more extra cautious than just making yourself lenient on doing things. Ibig sabihin po, mas gugustuhin mo na mag-extra, kahit pa sabihin ng maraming tao, gusto mo naman, napaka-extra. It is better kaysa i-minimize mo yung mga pwede mong gawin para maprotektahan mo ang sarili mo.
Yeah, you're correct. Any question? Kasi ako ang dami pang itatanong din eh. Kayo muna.
Hello, ma'am. I'd like to have a follow-up question.
Sure.
I'm Irene Rocco from King Saud University here in Riyadh, Saudi Arabia.
Hi, Rian. Kumusta po kayo dyan?
Dumadami na po ang cases, 50,000 as of today.
Oh, wow.
Yeah, so I am in the education department, and actually, I would like to ask if there are some policies from the medical director or from the hospitals where nurses are or nurses should not go out of the hospital with their white uniforms, because we are not working in the hospital actually, but we are trying to protect ourselves from from being transmitted or from having some infection coming from the hospital staff. Since we know that nurses are working in the hospital, I don't want to be biased with the nurses, but also because there are some experiences coming from anywhere that nurses are being bullied, or nurses are having some experiences of like they are being prevented from like getting their people are getting away from them.
Yes.
Because of the fear. So even me, I have also some experiences with that, like going to the grocery stores, like nurses here are wearing still their white uniform. Of course, we know that they're the one taking care of the patients, and they can transmit microorganisms or viruses from one patient to another. So as an educator, it's like I would like to know if there are some policies coming from the medical director that nurses should change their white uniform. It's not only from preventing transmission also, but also to prevent themselves from being separated or from being
Stigmatized.
bullied. Yeah.
Bullied,
So
stigmatized.
I am a nurse. I'm also worried as as a nurse, and I'm also an educator. Like it's like I just want to ask them if they feel like this also, being afraid of that they will be a source of transmission like that. And I know you have a very good practice before and after, but because of the white uniform, which denotes or connotes that you are working in a hospital, and because of the higher percentage of cases now, is there such move from or action from the nurses to just change their white uniform to common color or different color? I mean, so that they will not be bullied or they will not be feared of.
Okay, yes, Ma'am Che.
Thank you for the question. So, in my experience in our hospital, there is never a rule, there is never a policy or a guideline that nurses should change uniform after work. What we encourage is, which we encourage this. That means it's not mandated, but we reinforce and we encourage nurses, like, in order for you not to bring them, the contaminated scrub suit, we wear in here in adult ER, we wear blue scrub suit like this. This is what we wear. This is a regular scrub suit, and of course, it's blue. So we encourage nurses to put, once they go out, to change in their ordinary clothes, because it's not only to protect themselves but also to protect the people that is actually they're going to be meeting at home. But there was never a policy. We can wear our hospital code uniforms or scrub suits, which is the blue one that I just showed to you guys. Again, for the nurses that are stigmatized, I specifically experienced that myself. So as a rule, and I feel bad because, one time I was wearing this jacket, it says RN, and I went to a drive-through to buy some food for myself. It's lunchtime, and for my daughter and for my husband. And I was giving her my credit card, and what she did is, she was touching it like this, and I know that I'm wearing. I didn't realize. I was like, oh my God, why is she like that? Why is the cashier like that? I didn't realize, and she read my name, Cheryll Mack RN. I said, oh my God, that's probably the reason why. I felt bad, but you know what I did? I advocated for myself. I said, I am clean. My jacket is clean. Don't be scared. I don't have the virus, even though that I work in the hospital. But you see, again, that is a knowledge deficit that a lot of people have, but they always just presume that we can be carriers and we can be asymptomatic carriers of the COVID-19. So what I do to specifically dismiss, or I say minimize the fact that I will be bullied, because you can be stigmatized. When I say people look at you like with a look like if their eyes can kill, you would have been dead. Like I'm in the grocery store. I like to wear my jackets because I have extra jackets in my car. I have jackets that are just for the hospital or when I work for my shift. I never bring that at home. I never bring that in my car. So when I go, because it's a cooler weather, we're still springtime in the United States, so it's still cooler. When I go to a grocery store to buy basic needs, basic food, I wear, but most of them are like labeled RN. One time I was walking and the looks that I get is like, oh my God, I said, excuse me. And I felt offended, but again, I stood up and I say, you know what, you should not be treating us this way. And then I talked to the cashier. I said, you know what, this is a very nice grocery store, and it would have been very, very better. It's better if you guys will be treating the healthcare providers like me better. I don't need the look. What I need is understanding, because if you don't have me, there will be more positive patients coming in, because we take care of it. We put ourselves at risk. We put our lives at risk. We don't sign up as nurses to be dead or to die. No, we sign up to take care of people. So and then the cashier said, oh, I apologize. I really apologize. They apologized to me. And from then on, every time I have looks coming from people, or like just sneaky kind of like bicker, like yung mga what do you call that in Tagalog? Yung mga, Arlene, what do you call it? Yung mga pasaring.
Saring, yes, yes.
Be careful. Like, I always stand up for myself. I always never let people bully me, because I am proud of what I do. I save lives. I take care of patients. I see it that, and I see to it that my work is valued, because I save lives and I help eradicate this virus. I am never be ashamed of what I do, because I am a nurse. And people need to understand. And I think that people who doesn't know that has knowledge deficit, and they are the ones who need to learn. So that's just my stand. So, but in reference to the uniform, my hospital do not have a policy. We are but we are mandated to wear the hospital required uniform to work. And we are never also mandated to take it off when we get to work. It's just we encourage, we recommend, because these are things that are needed in order for you to contain the virus and to not to infect anybody at home, because you're going straight to your home. So that's basically what we do.
Yeah.
Okay, thank you, ma'am.
Okay.
Thank you.
Yeah. So basically, I think it's all about you really need to speak up as a healthcare worker. Speak up for your rights, but then you need to know in general that people will really, you will feel the stigma.
Yes,
so for
you do, you will.
So for you to take care of yourselves, ourselves, whenever we are outside the facility, we, as much as possible, we really need to have we really need to change our uniform.
Yep.
When we're outside. So, para ma-protectahan natin mga sarili natin. Yeah,
Yep,
so
exactly.
Any more question?
Question?
Yeah.
I have a question po.
Okay.
Sure, what is your name? Identify yourself.
Hello, ma'am. Good morning po.
Hi.
I'm Shamsuddin Arevalo from Kingdom of Saudi Arabia.
Can you make yourself louder?
I'm Shamsuddin Arevalo po from Kingdom of Saudi Arabia po.
Oh, hi, Saudi Arabia.
Yeah, I work also, ma'am, as a nurse paramedic.
Oh, wow.
Naintindihan ko po yung lahat ng mga sinabi nyo regarding from yung kit test natin. So, ma'am, I'm just more interested regarding your drastic or any updates on drastic management for a patient who is coded in ED.
Can you repeat your question? I cannot hear you very well.
Ma'am, I'm more interested regarding updates or drastic management for a patient COVID in ED.
Your question is, are there any what? Drastic management?
Drastic management in ED.
What kind of management, Arlene? I cannot hear very well.
Drastic management you implement in ED.
Oh, drastic management. What drastic management have we implemented in the ED? In reference to taking care of our patients?
COVID patient, yes.
What do you mean? Like, what drastic management? What do you mean?
Recently, ma'am, American Heart Association released a modified compression for a patient on prone position, actually.
Okay.
So, which
yes.
we are not actually practicing here as of.
Okay. Okay, so I know now. So yes, we do. So proning, meaning like the patient is so normally what the normal position is supine, right? So prone is like you are laying on basically on your chest and on your belly, right? So this is one of so when the patient is COVID positive and very symptomatic with short of breath, laying down like supine in a long period of time makes them more shorter breath. Why? Because the pool of all the secretions goes straight to the lungs, and then the lungs become more fluid filled, and that's the reason why they are more becoming short of breath or have difficulty breathing. So the best position to put them while they're waiting in the ED, what we do is we prone them in as long as they can and are able, because most of them are like, some of them are bariatric, some of them are like bigger in size. Some of them are really elderly that is really very vulnerable in body habitus. So we prone patients who are able to prone themselves and will be better off, especially when they stay in the ED for quite a while waiting for a bed assignment upstairs or to go to a unit. That is one thing. We recommend that very well, especially if the patient is not pulling any secretions or able to actually support their airway. Number 2, for the compression. So American Heart Association recommends that in a resuscitation, in a code, lesser people that are involved and exposed is better. So what we normally have a code, it's like in a whole shebang of all nurses, doctors, what we do is we minimize this to 2 nurses, 1 doctor, 1 attending, 1 respiratory therapist, and 1 compression. So fortunately in our ED, we acquired this Lucas, which is a manual CPR machine that does the CPR for us instead of doing by person. So instead of more exposing, because you know, when you do resuscitation, you have to switch every 2 minutes, correct? If you know it, you're a paramedic. But instead of exposing 2 or 3 more people, what we do is, as soon as we know that this is going to be a long 20 minutes, 30 minutes code of CPR, we already get our Lucas. It's if you will Google it, it's a mechanical CPR machine that does the CPR for you once we put it in. So we are all certified to use it. It's not very hard. It's very easy actually. And so that minimizes the presence of 2 or 3 more people inside the room. We have that. So that's really actually not really, I say, drastic. We have been doing that before, but it's all only indicated for ECMO patients and long resuscitation. But at this point in time, we have it available for our nurses, for the team, for the ED to use, especially if we know the patient is a known COVID positive patient. Another one that we also do as management is we have acquired multiple tubes, or like I say, what do you call this? Yung mga gravity tubings. So when we are on, if the patient is on drips, multiple drips, instead of you are going to be exposed for a long time inside the patient's room, what we develop is we put the pump outside and connected it with long tubings. It still is connected to the patient, and so the pump is outside, so we can titrate them without exposing ourselves inside the room. So that is one of the great things that we are doing in the emergency department. Another one is we have I don't know if this is something that because you know, gridlock is very common in the emergency department, meaning where patients are staying in the ED for a long time because of waiting for beds to become available to go to a unit or to an ICU. What we develop is a coordination between our intensivists and hospitalists to come to the emergency department as soon as we call them. They are not waiting too long. So the exposure of the COVID patient in the ED is not as long. They will admit them in a very timely manner and bring them away. So meaning we can ease up the patient's room, clean it up, and ready for another patient. So it's like a coordination of multiple consultants and multiple teams to admit the patient. Another one is, other than prone, we have the Lucas, we have the drips, the tubings. We also, you know what else, what we develop is, this is very simple, but you might encourage your unit to do this. We develop 2-go intubation boxes, 2-go IV start kits, 2-go medication kits. So because again, we are rushing, always the culture, the ED, but when we know that the patient is being intubated, right, we have the 2-go. We don't have to get it from different places. So we have a kit that we know this is, so it involves the ambo bag is there, the what do you call it? And this is very different compared to the intubation box. We don't bring the intubation box inside the room, but we have the 2-go, the meaning the basic, that the minimum that the patient would be used for intubation. We have the 2-go. So when the doctor said, we're going to intubate this patient, what size? So there are the sizes of it, and then we grab it and bring it in the room. So less exposure of the equipments, but it's the basic that we can provide. So even the IV starting kits, we have the 2-go of that. Once the nurses, I want to have to go, so you don't have to dump your hands or contaminate any kind of IV carts. You already have the 2-go IV kits to bring inside your room. Another one that we develop is, and we actually just have an in-service on this, it's called a head tent ventilation. Remember, the most common way to transmit or to spread the COVID-19 on a patient is putting the patient in some kind of aerosolizing general procedure, or we call it AGP, right? What are those? Neb treatments, right? Nebulizing treatments. We also have intubation itself, putting the patient on high flow nasal cannula or vapotherms, or putting the patient on non-rebreather. Why? Because the air is spreading, right? You spread it very, very fast. So what we did, and even BiPAP and CPAP, because even though you contain them, you still spread it. So what we developed is the hospital recently acquired, and we got this. This is like again from the convergence with Johns Hopkins, which is the research another hospital that we converge with, helping out to facilitate the what do you call this? So the field hospital that I was talking earlier. They have acquired 5 of them. They are quite pricey, but it's called the head tent ventilation. So it is it's a bubble. It's like a bubble that you put it on the head, and then it's latex free. The rubber attaches to the shoulder of the patient. So basically, if the patient is if the patient is not claustrophobic, you put it in. You put him basically in pressure support and PEEP of 5, a very regular setting for the vent, and that is better because you are containing, but also delivering a tidal volume enough for the patient to breathe normal and to ease up the difficulty of breathing. So we call it HTV. We are actually piloting that next week. I wish I can show you a picture of it, but when you Google it, you go to images, you just put in head tent ventilation, it will come up and you will know what I'm talking about. It is contained, it is not spreading the virus, and it is not basically an aerosolizing treatment because it's not spreading, but it's containing the person itself to spread the virus, but it's still delivering the best oxygen, the best air that the patient can have in order for her or him to have to have better breathing and to avoid deteriorating for becoming more hypoxic. So those are I say management that are more technology. I mean, like more advanced, as you say it. I don't say it drastic, but I say it's more advanced and more. I say management that is basically is to prevent a spread of COVID-19 in our community in the adult ED. Did I answer your question?
Yes, ma'am. Thank you.
Thank you.
Any more question? Okay, ako naman ulit.
Sure.
Okay. Ma'am Che, about we all know it will not just be for the healthcare worker, but it will happen also and should be done for all those patients who had the COVID. How do you manage the psychological aspects? We do know the psychological first aid, the skill psychological implementation. So are you providing it with your staff, with the employees, and even with the patients? Because we always concentrating on the treatment. We haven't heard, very seldom that we will hear, even in FB, or very seldom we will hear about the psychological first aid for all those affected by COVID and the employees. What about it?
So what we do, very, very fortunate in our emergency department that we have our partners with, we call it psych emergency services. So we have a pool of counselors, social workers. We call them clinical social workers. They are actually in the ED. They are there 24/7. Not only them, and they are also like the case managers. So if the patient is wanting and is asking for some kind of counseling in reference to how can they prevent just a peace of mind, basically peace of mind, and to ease up the pain of the emotional drain, because you were healthy before, and all of a sudden here you look at you're a nurse provider before, you were taking care of patients, now you are the patient. So that's basically the hardest part to accept. So we are providing and so once we put that in the orders of the doctor that the patient will be needing some psych emergency services consult, it triggers in their chart. So they go straight to the room. They don't go straight. We talk to them, again, less exposure. They talk through iPads like this or cameras, and then we give them resources. If it's a nurse or a doctor that get contaminated or get the virus, what we do, we have a dedicated 24/7 RISE, RISE, is like resilience to stressful events.
Yeah.
People, or like and it is inbound. It's like when I say inbound, it's in the hospital. There are pool of social workers, case managers, counselors, chaplains that can be actually called in and talked to by the nurse or the doctors, whoever is the employee that got sick because of COVID. So and we also have the employee assistance program. This is free for all our employees. That there are also psychiatrists, there are also psychologists, counselors that can actually help them out, alleviate the psychological pain that had caused by the disease. If you are a patient, what we do is socially, if you don't have the capability to quarantine yourself, the social workers have resources that are in coordination with our the state government, again with Governor Larry Hogan. They provide hotels. They provide, as a matter of fact, half of the convention center they provide for people who are homeless. So these are social problems that we address even before they get especially if they don't have a house to quarantine themselves. We also provide them with not shelters, because they are, we don't do shelters during pandemic because this is only an avenue to spread more disease. But we provide them hotels. And we also provide them with a week-long medication that they need in order for them not to be able to go out and have it available right away. And also we provide them with food. And that's one thing great here in the United States. The government is very involved, and I'm very thankful that it is, because had it not been, there are lots, these people will be able to go home. These COVID patients, homeless people, will be able to go out and just, spread the disease more and more. But because we have a very good help from the government through our governor of the state, and our hospital really partakes in implementing, or in the initiatives of implementing this kind of resources to be able to help our less fortunate population, which we have a lot, to go out and be functional again, and to live, back to the basic life that they had prior to having the COVID disease. So it's two-way. We provide resources to the patients as we provide resources also for the healthcare providers. I can tell you our hospital had honored us so much in terms of giving us COVID premium pay, giving us free hotels. As a matter of fact, just to let you know, I took advantage of it. So I am a member of the Emergency Nurses Association. And because I worked multiple nights and I have to travel an hour away to the hospital back to my house. So in order for me to be more safer, because I am tired after 12-hour shift, what the ENA does for all members of this, emergency nurses, they provide free accommodation for no matter how many days you want for the month of May and June. So what I did is I went to Hilton Hotel, which is a great hotel.
Oh, wow.
In 5-star hotel in Baltimore, and I housed myself for 7 days. I didn't pay any dime. I didn't pay anything. They provided me with my breakfast, like a to-go breakfast. They provide me dinner, and they provided me a shuttle. All because they are very supportive of the nurses here, and that's one thing I'm very, very proud and very thankful of here in United States. Like, we are lucky, we have lots of those kind of resources. And I really do hope that, a lot more nurses are experiencing this in different regions, different parts of the world. And the reason why I partake on that is because I would like to know if it's really real, because they market it. They told the nurses. And then I said, oh, is this really real? When I called them, I said, yes, you can stay here anytime. They gave me my ticket. They gave me my accommodation. They gave me a nice, really bed. Like, it's a 5-star hotel, and I was so happy. And when I left the hotel, I said, thank you so much for giving. And this is really recognizing what we do in the community.
Yeah.
And they said, yeah, of course, because you are taking your risk. You are taking your life. And plus the fact that they don't have business anyway because nobody's traveling. Nobody's going out of the house.
Yeah,
So might
yeah.
as well. And they're very so normally they give us 50% when there's like, for example, like a snow blizzard that we are going to be staying in the hospital. So instead of staying in cots and or like rooms, like clean rooms of the patient, like without patients during winter times, we go to hotels and they gave us 50%. But at this time, I'm so happy and I'm very impressed because they might not be directly what do you call it, helping out to spread to prevent the spread of the disease, but they are helping out the healthcare providers that's like us to have a better living in times of pandemic, especially now that we are working so hard to really help out, take care of our COVID patients. I love the fact, and then we have lots of freebies. Every day is donated food from the community. Every day is donated what do you call this, freebies. Some of this are donated, some of the masks are donated. As a matter of fact, the School of Nursing, University of Maryland School of Nursing, donated 6,500 masks to us, cloth masks. They are really nice to us. So we feel very honored. We feel very lucky. And these kind of things make you more emotionally stable, make you more work hard for the patient. Yep. So those are the things that we actually get as a healthcare provider.
Yeah, that's good. You're so fortunate.
We are.
Yeah, I hope our nurses in Philippines, all our healthcare workers in Philippines will have the same, but we will just have a we'll see. And we cannot force the government. It's all about the condition and the status of our country. But then every time I watch, I always do. I have a TFC, the Filipino channel. Every time I watch the news about the plight of the nurses in general in the Philippines, that some of them stays in the hospital, has to be mandated to stay there. I mean, I cannot for sure say something about if they are not being helped or anything, but the fact that there are the shortage of the PPEs, and the fact that it's so sad that every time I go and look at the updates of who died, the nurse died of this, I felt so hard. It's really draining to me emotionally, because it could have been me, it could have been you, it could have been anybody, but we are luckier we weren't. But because of the reason is they are short of PPEs, they were infected, they didn't know. The organization they are working with are not as involved and are not as engaging and are not supportive. And this is, again, I'm going to go back. This is not the task of life that we signed for. We signed for to save lives. We didn't sign to die. So I just feel so bad that and it is happening worldwide. I mean, also here in the United States, there are some parts, so there are some states that became very short of PPEs, and to the fact that they cannot provide them the best protection for the nurses. So I feel lucky because our organization is very particular with providing us the best PPEs we can ever have. Yeah.
And I really do hope it applies to all of you, to all, especially our kababayan. I really do. It really hurts me. It really hurts my feelings seeing that, the increased rate of nurses, Filipino nurses dying, or just nurses dying in general because of COVID-19 exposure.
We'll keep on monitoring the condition of our nurses in Philippines, but we cannot do anything. We're far from them. We will just voice it out. So that's what we can help. That will be our support. But then, any more questions from our? Do you still have time, Ma'am Che? This is my question
I love
also
questions.
for you. Okay, do you still have question for Ma'am Che? For our participants, please raise your question. Feel free.
One question.
Sure.
In the States, particularly, do they already develop a kind of medication or a kind of vaccine that can treat this kind of viruses? I mean, is there a way they already develop medication for this? Did they try?
I can tell you that there's the Department of Health and the CDC are partnering. I've seen a lot of news. I've seen a lot of evidence-based literature that had they are not I say rushing, but yes, they are preparing. They are trialing a vaccine that will eradicate this coronavirus. In reference to medication, there's no specific medication that had been developed yet. But if you know this, we have used this to multiple of our patients. The combination of Planaquil and azithromycin, I believe it's an antibiotic.
Yes.
Planaquil is a medication that is more like, I think it's a medication. I don't want to tell you what does it do to the patient, but it's a combination of Planaquil and azithromycin, basically to treat the infectious process of the COVID-19. Has it been proven? Has it been proven great? Has it been proven it solved the problem? No. But it seems like they are using it because they want like to place in a more comfortable zone that they are treating it. Because most of the signs of the COVID-19 are more upper respiratory, and Zithromax is one of the medication, if you guys have that, is one of the medication which is more broad kind of it's a more broad spectrum of an antibiotic that can treat upper respiratory infections, and so they are using that basically not to treat COVID, but basically to treat the symptoms that would have that is originally caused by the virus. So to answer that question, yes, we are developing. They are, as a matter of fact, we are the government. Our government is very supportive of this research innovation in developing a vaccine for the COVID-19. There's a lot of things more to do. You know, it's experimental. You have to test that to animals. You have to test that for anything else before they test it to humans. It's not something that is today we're going to do it, tomorrow we're going to use it. So there will be a lot of random sampling, random trialing. It's going to take a long time. That's why I said COVID-19 pandemic is not going to stop anytime soon. This is not something that, you know, in any kind of pandemic, the Spanish flu pandemic, back in the days, the Ebola, like, you know, and this fight is ongoing. This will be ongoing, and this is going to be prolonged until we really actually find a vaccine that will treat it. It will not take a day. It will take long and long hours, more days, weeks, and you know, and again, it is not something that they have to rush to do it. It is something that they have to do. Really, it's safe for the people, and it will actually serve best for the whole population. And something, you know, science is always have to be tested, especially if it involves human beings.
Yeah. That's it. Any more questions? I think we need to have three more questions. Okay.
Sure.
Good evening. This is AJ from Jeddah.
Yes,
AJ. Hi, AJ. Hi, Jeddah.
I'm working in the cardiac cath lab.
Oh wow.
Yeah.
I'm wondering how you guys do your COVID patients.
Full PPE.
Yes, of course. And I bet you develop an algorithm as well from how the patient will go straight to the cath lab in a tract, so not contaminating the rest of your stations, or you call it like base for cath lab.
Yeah. Anyway, my question, just a follow-up on the previous question. Did your institution already considered or have already used, considering the use of convalescent plasma?
Yes. Actually, a lot of the so we have a critical care resuscitation unit / BCU unit, and I've heard a lot of the sicker patients they have used the plasma or convalescent plasma in order to actually save the spread of the COVID-19 in the body system, or in the body, actually basically in the bloodstream. So they have, I have not seen it myself in the ED done it, because normally this is in an ICU setting. So I cannot speak about or on how it is being processed, but I've seen it being used. Our hospital is one of those training hospital that is more on research and innovation, and certainly we are using all this innovative management in order to take care of a more sicker COVID-19 patients. I've heard about it. I've never heard anything that I've never heard yet had kung ano or what had it done on a patient, but I've heard it's being used. Yes, in an ICU setting.
Thank you.
Mm-hmm.
Okay.
You work in a cardiac unit. I have a question for you, if you don't mind.
Yes, ma'am.
So, are you familiar with this medication that is actually a medication that is intended for COVID patient who is presenting with STEMI or the ST elevation symptoms? Tinectiplase. Have you heard about that?
Not yet.
So this is anti-aggregate. What do you call this? It's a lytic. It's it's like a heparin, but it's high. It's a higher molecular weight.
Like
so
Integrilin or something.
Correct, but this is Tinectiplase, but it's on the same range. This is recommended by a lot of cardiologists to use for positive confirmed cases who are presenting with STEMI, because they said it's either because evidence-based, I can tell you that a lot of the patients coming with STEMI are also they said that it is something to do with COVID-19 affecting why the patient is developing a blood clot or a clot in their heart, or a thrombus. I don't know how to believe that is, but it could have been possibly because it's very, very close to the lungs and the heart. But Tinectiplase is like a lytic. It's like a heparin, a low molecular weight, less complications of bleeding, and that's what they use. And it's IV push. You push it in 5 minutes to lyse the clots for positive COVID patients.
Tinectiplase, am I right?
Tinectiplase, yeah, you can Google it.
Okay, I
We are using
research about it.
Thank you. That is one of you can Google it and you will see it. It's prepared by pharmacists. Nurses can push it in 5 minutes, and normally the setting is we do it in the emergency department.
Okay, thank you, ma'am, for that information.
Thank you, appreciate you.
Okay, we still have 2 more questions.
Sure.
Any more? Oh, none. Okay, one more for me, Ma'am Che.
Yes.
Nurses are having long hours of duty. Do you prefer also the shortened hours so that we will have shortened exposure with the cases?
Okay. Based from experience, it is actually if you work 12 hours, we try to in our ER, our shifts are 12 hours, 7A to 7P and 7P to 7A. Some units have the 8-hour shift, the 7 to 3, 3 to 11, 11 to 11 p.m. to 7 a.m. Even though you work 12 hours or lean, it doesn't mean that you are exposed 12-hour shift also. You are in the hospital, yes, but basically what we do is we lessen the exposure of our nurses. So we do make ways to be sure that we measure the amount of time they are inside the room.
Okay. Yeah.
So it has nothing to do with the number of hours. It's the same way you're going to be exposed now. Because they can only be wearing their poppers or PPEs for maximum of 2 hours.
Okay. They can so you can just have 8 to 12 hours, but then you have a minimized patient engagement.
Exposure, yeah, exactly.
Okay.
And the thing is, I think it's for some nurses it's helpful to have 8 hours. It's because it's not just being exposed. It is the gravity of, dreading to come to work, especially if you for example, you work night shift. It's really hard. Taking care of COVID patient is not something. It's different. It's very tasky. The need of the donning and the doffing, and always be very cautious of you are not contaminating yourself or even putting other people at risk. So it is more extra work than just the regular work that you normally do even before or prior to COVID-19. Again, we try to the best to, again, the spot that I told you earlier, we time them when they go inside the room and come out outside the room. Be sure that, we don't expose our nurses too much for them to be infected or to them to be burnt in a single 12-hour shift.
Yeah.
Yep.
Okay. I think that's it. Ma'am Che is on duty. Talagang pinilit ko lang siya na makasama natin.
Because it's you, Arlene.
Yeah, I know.
I am like you, Arlene. I will advocate for this because I am one of those that is very passionate and dedicated to really help out. That because it's, just like what I said in my interview in Reuters news. This is something that had affected a lot of lives in the world, like not only lives of the people, but the livelihood. This is not what we have normally, and it had affected. And we are always looking for what is normal. We need to go back to what is normal. Yes. And in order for that's what I said. This is not an individual task. This is everybody's task. It doesn't need to be you are a nurse or a doctor. It is everyone's. And again, I cannot tell enough. We are on this fight all together, and we will get through this together.
Before Ma'am Che have her last words, this is my words also to all. COVID-19 will still be here. Will still be here for long time until the vaccine will be released. What we just really need to do is learn to adjust, learn to adapt. Hindi mawawala yung COVID, andyan yan. And we will not forever be isolated. And what we just really need to do is to apply yung tinatawag natin nga na new normal, na it will be part of our lifestyle now while we are waiting for this vaccine, for this treatment, that we need to wear the mask, we need to have our gloves outside, we need to have our own hand sanitizers, and there will be monitoring of temperatures everywhere, or even in sa mga entrances. That will be the part of our lifestyle now.
Yep, exactly.
So we cannot deny the fact na dapat na lagi na lang tayong isolated. Hindi magpo-progress ang bansa kung ito forever tayong isolated. Malaki ang effect sa ekonomiya. So it's the people who should really understand the new normal and how they will adapt with the environment. So this will be my share with you guys, and I just want to turn it over to Ma'am Che for her last advice or last words to us before we maghiwalay. Okay.
Yep. So first and foremost, thank you for the opportunity for sharing my thoughts and experiences here in the United States, my home hospital, University of Maryland Medical Center. I'd like to thank Arlene for giving this opportunity to share. This is one of my advocacies as a nurse, is to share every information that I have, especially if it entails like helping out for people to be more knowledgeable and more educated in terms of COVID-19. Thank you so much. And again, before I would like to thank each one of you from the bottom of my heart. I don't see your faces. I don't know you personally, but anybody who is part of this webinar from Riyadh, Saudi Arabia, Philippines, my family who's also watching me, thank you so much for the time and opportunity that you have given me and listening to me. I really do appreciate it. I might not know you very well or personally, but from the bottom of my heart, I do appreciate each one of you. What I am calling in for the world, is maging vigilant po tayo sa mundo. Maging vigilant po tayo sa nangyayari sa mundo. I-educate po natin ang ating sarili, magbasa po tayo, makinig sa radyo. Even though sometimes it's very frustrating, but it's the reality of life. Kasi kung hindi po tayo mag-increase ang ating knowledge, and we will be very always deficit, and we will always have this gap na wala tayong nalalaman kung anong nagaganap sa buong mundo, especially ngayong pandemya or pandemic ng COVID, mas mahirap po yun. Kasi hindi nyo alam ang gagawin ninyo, magiging anxious kayo, magiging paranoid kayo. Sabi nga po, pag COVID, social distance, pero hindi social isolation. So, para po, hindi po natin dapat i-isolate ang ating mga sarili. Ang kinakailangan po natin gawin, maging educated tayo at alamin kung ano ang mga dapat gawin para po hindi natin mapalaganap ang or spread ng COVID-19 sa ibang tao. Hindi po, at ang kinakailangan rin po is very basic po, I will reinforce this, I will not mandate this. Yung pong pagiging malinis sa sarili is, again, I do believe cleanliness is next to godliness. So, sanitation of your hands, hand washing, ito po yung mga basic, but truthfully, ito po yung makakasolve at stop or decrease the rate of contamination or spread po ng COVID sa environment. At another thing po is maging nurturing po tayo, maging sa bawat isa, lalong-lalo na po sa mga health providers kagaya natin. Hindi po namin kinakailangan ng stigma, hindi po namin kinakailangan i-bully, hindi po namin kinakailangan tingnan ng masasama or, nurse yan, ganyan-ganyan, or iwasan. Ang kinakailangan po namin is mai-recognize nyo po na valuable ang ginagawa namin. We are taking our own life at risk to take care of our COVID patients, for them to feel better. Again, I'm gonna say, this is not we will sign off, but we did, and we are doing it. Kasi nga po, ito ang aming sinumpaan. Florence Nightingale is service to the world, service to the population as nurses. Kaya ang hinihingi ko po ay nurturing behavior or yung more understanding and more engaging and more recognizing that and you value what we do for the nation, for the world. And again, hindi lang po ito sa aking advocacy, hindi lang po ito kay Arlene, hindi lang po ito sa lahat ng mga nurses at healthcare providers na nag-aalaga, lahat po ito. This is our fight together, and I will tell you, this cannot be done individually. We should be in this fight together, and only then that we can get through this together. This is going to be a long journey, and we need to be hand in hand helping each other to eradicate COVID-19. Maraming salamat po. Sana po nakapagbigay ako sa inyo ng enlightenment in reference to sa aking mga experiences dito po sa being a nurse dito po sa United States. At sa muli po nating pagkikita. Maraming salamat po at mabuhay po kayong lahat sa lahat ng mga nurses na nakinig at lahat po, all over the world. I am so proud of you. You guys are really great heroes, and wherever you are, I can tell you, you are the bravest persons. We are the bravest persons. Because why? We are staking our lives to save lives. And salute to everybody. Maraming salamat po at magandang gabi sa inyong lahat.